Your doctor handed you a prescription, you filled it, you've been taking it for months, maybe years, and right now, without you even knowing it, that pill could be quietly erasing your memory. I'm not talking about rare side effects, I'm not talking about extreme doses, I'm talking about 9 of the most commonly prescribed medications in the world, drugs sitting in millions of medicine cabinets right now that have been directly linked to rapid cognitive decline, memory loss, and in some cases, full blown dementia that doctors mistook for Alzheimer's. Stay with me for the next 15 minutes because this video could be the most important thing you watch this year for yourself or for someone you love. And here's what nobody tells you. Dementia is not always a slow, inevitable slide into old age. Sometimes, and this is the part that should make your blood run cold, it happens fast. People go from sharp and functional to confused and forgetful within weeks or months, and their families assume the worst. They start Googling Alzheimer's care facilities. They grieve. But here's the thing, in a significant number of those cases, the cause wasn't a disease destroying the brain. It was a drug, a medication, something prescribed by a trusted physician, often for a completely unrelated condition. Sleep anxiety, allergies, bladder control, even heartburn. The medical community has a term for this. It's called drug-induced cognitive impairment, and researchers estimate it may account for up to 12% of all dementia cases that were originally misdiagnosed. 12%. That means hundreds of thousands of people right now may be in memory care, away from their families, their homes, their lives, because nobody stopped to look at what was in their pill organizer. So that's what we're going to do today. We're going to look, we're going to name names, and I'm going to tell you exactly what to watch for and what to do if someone you love is on one of these medications. Let's get into it. Let's start with the one that's probably going to surprise you the least, but whose scope is going to shock you. Benzodiazepines, benzos. These are the anti-anxiety and sleep medications that have been prescribed since the 1960s, and they are still being handed out like candy. We're talking about Xanax, Valium, Ativan, Klonopin, names you've almost certainly heard before. Here's the problem. Benzos work by enhancing a chemical in your brain called GABA. Basically, they slow down your nervous system. That's great for calming a panic attack. But long term, that same mechanism suppresses activity in the hippocampus on the part of your brain that forms and retrieves memories. Studies out of France and Canada, large ones covering tens of thousands of patients, found that long-term benzo users had a 50% higher risk of developing Alzheimer's type dementia compared to non-users. And the withdrawal? Even coming off benzos can cause temporary but severe cognitive fog that looks exactly like rapid onset dementia. If someone you know is on a benzo and suddenly seems confused, repetitive, or disoriented, this is the first thing you need to flag to their doctor. Let me be real with you for a second. I know some of you watching this are on one of these medications, and I'm not here to scare you into flushing your prescription down the toilet. That is not what this video is. These drugs exist for real reasons. They help real people. What this video is information, because informed patients make better decisions with their doctors, and right now millions of people are not being told about these risks. Okay, let's keep going. This next category, this one right here, this is the one that keeps neurologists up at night. Anticholinergic drugs block a neurotransmitter called acetylcholine, and that neurotransmitter is critical for memory and learning. In fact, one of the hallmark features of Alzheimer's disease is a drop in acetylcholine levels in the brain. So what happens when you take a drug that blocks that same chemical? Especially for years, you get the same result. And here's the thing that makes this category so dangerous. These drugs are everywhere. We're talking about diphenhydramine. That's the active ingredient in Benadryl, Unisom, Zazquil, and dozens of PM pain relievers like Tylenol PM and Advil PM. We're talking about oxybutynin, prescribed for overactive bladder, hydroxyzine, prescribed for anxiety and itching, cyclobenzaprine, a common muscle relaxer, amitriptyline, an older antidepressant still widely used for sleep and nerve pain. A landmark study published in JAMA Internal Medicine found that people who took anticholinergic medications for a cumulative total of 3 years or more had a 54% higher risk of developing dementia. And the scariest part? Many people don't even realize these are serious drugs. They buy Benadryl at the gas station. They pop a Zizquil because they can't sleep. They've been doing it for years. Heartburn medicine. You didn't see that one coming, did you? Proton pump inhibitors, ISAPP, ISAs, are among the most widely prescribed drugs on earth. Prilosec, Nexium, Prevacid, and people take them for acid reflux and GERD, and they take them for years, sometimes decades. The problem is that long-term PPI use has been linked to deficiencies in vitamin B12 and magnesium iodine, two nutrients that are absolutely critical for brain health. B12 deficiency alone can cause memory loss, confusion, and cognitive symptoms that are virtually indistinguishable from early dementia. A German study involving 74,000 participants found that regular PPI users had a 44% increased risk of dementia compared to non users. Now, some studies have pushed back on this and the research is ongoing, but here's the practical takeaway. If you or someone you love has been on a PPI for more than a year and is showing cognitive changes, B12 levels should be checked immediately. It's a simple blood test, and if deficiency is found, the improvement after supplementation can be dramatic and fast. This one is controversial, and I want to be fair about that. Statins are cholesterol lowering drugs, Lipitor, Crestor, Zocor, and they are among the most prescribed medications in history. The evidence for their benefit in reducing heart attack and stroke risk is strong and real, but the FDA added a memory and cognitive impairment warning to all statin labels back in 2012 because reports kept coming in. Patients, often otherwise healthy, sharp people, were reporting sudden, significant memory problems after starting statin therapy. The mechanism: your brain is made of 60% fat and it relies on cholesterol to build and maintain neurons. Some researchers believe that in certain individuals, dramatically reducing cholesterol can impair the brain's ability to function at full capacity. The good news: in most reported cases, the cognitive symptoms reversed when the statin was stopped or switched. That's a key distinction from Alzheimer's. The damage is often not permanent. If you or someone you know started a statin and noticed cognitive changes within weeks or months, that timing matters. Tell the prescribing doctor. The Z drugs: Zolpidem, Esopiclone, Zaleplon, Ambien, Lunesta, Sonata. These are the big prescription sleep medications, and they're given to millions of people, especially older adults and not for insomnia. Now, here's the problem in a nutshell: sleep is when your brain cleans itself. During deep sleep, your brain's lymphatic system flushes out metabolic waste, including amyloid beta plaques, the same plaques associated with Alzheimer's disease. When you take a sedative sleep aid, you get sedation, but you don't necessarily get restorative sleep. You suppress the deep sleep stages your brain needs for that cleaning process. Long-term use of Z drugs has been associated with increased dementia risk in multiple studies, and there's a paradox here. People take sleep meds because poor sleep is bad for the brain, but some sleep meds may be making the underlying brain health problem worse. Non-drug interventions for insomnia, particularly CBTI, cognitive behavioral therapy for insomnia, have been shown to be more effective long-term than medication, worth discussing with a doctor. Not all antidepressants carry the same risk here. I want to be clear on that. The newer SSRIs and SNRIs, Prozac, Zoloft, Effexor, have a much cleaner profile. But the older tricyclic antidepressants, estindetasine, amitriptyline, which is Elavil, and nortriptyline, which is Pamelor, these are heavily anticholinergic and are still being prescribed today, often for sleep, nerve pain, and migraines. Elderly patients are especially vulnerable, and these drugs are explicitly listed on the Beers criteria, a list maintained by the American Geriatric Society of drugs that are potentially inappropriate for older adults. If an elderly person you know is on one of these older antidepressants, it's worth a conversation with their doctor about whether a newer alternative might be appropriate. I want to tell you about a pattern that shows up over and over in the research and in real families. An older adult starts acting strange, forgetting conversations they just had, getting confused about what day it is, maybe becoming a little paranoid. The family panics, the doctor does a cognitive assessment, the word dementia gets used, everybody starts making plans, and then, sometimes by accident, sometimes because one sharp family member or nurse noticed something, somebody looks at the medication list and they find it, the culprit, the drug gets stopped or changed, and within weeks, sometimes within days, the person comes back. The memory improves, the confusion lifts. This is called reversible dementia, and it is real, and it is being missed every single day. You keeping track of these? Let's do the final three. This one may be the least surprising, but the mechanism is worth understanding. Opioids don't just kill pain, they fundamentally alter brain chemistry. They bind to receptors throughout the brain, including in the hippocampus and prefrontal cortex, the regions responsible for memory, decision making, and personality. Long-term opioid use has been associated with brain shrinkage in imaging studies, particularly in the prefrontal cortex. People on long-term opioids often show measurable declines in attention, processing speed, and memory even in the absence of intoxication or withdrawal. And opioids are being prescribed to older adults with chronic pain after surgeries for cancer at high rates. Balancing pain management against cognitive risk is a genuinely difficult problem, and it's a conversation worth having openly with any prescribing physician. Short-term steroids, like a 5-day course of prednisone for inflammation, that are generally fine for most people. It's the long-term use that raises red flags. Chronic corticosteroid use elevates cortisol, the stress hormone, for sustained periods. And chronically elevated cortisol has a well-documented toxic effect on the hippocampus. It literally causes hippocampal neurons to shrink and die. People on long-term steroids for conditions like lupus, rheumatoid arthritis, asthma, or inflammatory bowel disease often report mood changes, memory problems, and difficulty concentrating. Some patients call it prednisone brain or steroid fog. If someone is on long-term steroids and showing cognitive changes, the risk-benefit of continuing that therapy at current doses is absolutely a conversation worth having. We come back to the anticholinergic family one more time, right? Because this class is that dangerous and that widespread. We already covered Benadryl, but there's another group. Overactive bladder medications like tolterodine, which is Detrol, sulfasenacin, which is Vesicare, and oxybutynin, all heavily anticholinergic, all commonly prescribed to elderly patients, all showing up repeatedly in dementia research. And there is a cruel irony at work here. Older adults with overactive bladder get prescribed these medications. Those same medications can cause confusion and cognitive decline. The confusion gets labeled as dementia, and nobody connects it to the bladder pill. Bladder control issues are treatable with behavioral therapies, pelvic floor exercises, and newer medications with much lower anticholinergic burden, like mirabegron, which is myrbetriq. If someone you know is on an OAB medication and showing cognitive symptoms, bring this up. There may be a safer option. Alright, let's rapid fire the full list one more time so you can screenshot this. Number 1, benzodiazepines, Xanax, Valium, Ativan, Clonopin. Number 2, anticholinergics, Benadryl, Unisom, Dramamine, hydroxyzine, cyclobenzaprine. Number 3, proton pump inhibitors, Prilosec, Nexium, Prevacid. Number 4, statins, Lipitor, Crestor, Zocor. Number 5, Z-drug sleep aids, Ambien, Lunesta, Sonata. Number 6, tricyclic antidepressants, Elavil, Pamelor. Number 7, opioids, Oxycontin, hydrocodone, morphine. Number 8, corticosteroids, prednisone, dexamethasone. Number 9, bladder medications, Detrol, Vesicare, Ditropan. 9 medications, millions of prescriptions, and most people have never been told about any of this. Here's what I want you to take away from this video. This is not about fear. It's not about distrust of doctors. It's about one thing: being an informed advocate for yourself, for your parents, for whoever you love. Most physicians are not withholding this information out of negligence. They're busy. They're managing dozens of conditions per patient. And the connection between a specific medication and a patient's memory complaint doesn't always surface in a 15-minute appointment. You surfacing it can change everything. If someone you love is showing signs of cognitive decline, take 3 steps. Step 1, write down every single medication they're taking, including over-the-counter drugs, sleep aids, and supplements. Step 2, cross-reference that list against what you heard today. Look for anticholinergics especially. Step 3, bring that list to their doctor and ask directly, could any of these be contributing to cognitive symptoms? That's it. 3 steps. That conversation could give someone their life back. If this video helped you, if it made you think about someone in your life, do me a favor and share it right now. Send it to one person, post it on your family group chat, because the person who needs to see this probably isn't going to find it on their own. And if you want more content like this, straight talk health information that your doctor doesn't have time to give you, hit subscribe and turn on notifications. I drop new videos every week. Drop a comment below and tell me which medication on this list surprised you most. I read every comment and I'll be in the replies. I'll see you in the next one. Take care of yourselves and each other.